All right, let's talk about something that affects millions of people, asthma. It can make something as basic as breathing feel like a huge challenge. So today we're going to break it all down, what it is, what causes it, and most importantly, how you can manage it and live a totally full and active life. You know that feeling, that scary moment where you're suddenly struggling for air and it feels like your own body is fighting against you? For a lot of people, that's not just a one-time thing. It's a sign that something bigger is going on inside their airways. So, what exactly is this? Let's get right to the heart of what's happening when that struggle for breath kicks in. Okay, so the official definition sounds a bit technical, but let's break it down. Chronic just means it's long-term. Inflammatory disease of the airways means the tubes carrying air to your lungs are pretty much always a little bit swollen and sensitive. That's the hyperresponsiveness part. They totally overreact to things that wouldn't bother other people. But here's the key word, reversible. That means with the right plan, we can open those airways right back up. So what does an asthma flare-up actually feel like? Well, it usually comes down to these four classic signs. You've got wheezing, that high-pitched whistling sound. Then there's just plain shortness of breath. A lot of people also describe this awful chest tightness, like a band is squeezing them. And finally, there's that nagging cough, which for some reason always seems to get worse at night. To really understand those symptoms, we've got to take a look under the hood. What is actually going on inside your lungs when an asthma attack happens? And wow, this picture says it all, doesn't it? On the left, a healthy airway is nice and open, air just flows right through. But look at the asthmatic airway on the right. It's a triple threat. The walls are swollen, the muscles around it are squeezing super tight, that's a bronchospasm, and it's all clogged up with thick mucus. It's literally like trying to breathe through a narrow, gunk-filled straw. No wonder it's so hard to catch a breath. So how does it all happen so fast? Well, it's a super fast chain reaction. It all starts with a trigger. Could be anything from dust to smoke. Because the airways are already so sensitive, the immune system just goes haywire. It floods the area with chemicals, and that's what causes that trifecta of problems. The muscles tighten, the walls swell up, and your body produces way too much mucus. And voila, you have an asthma attack. This brings us to a really important question. What exactly are these triggers? Because figuring out what sets off that chain reaction is a massive step toward getting your asthma under control. The list of things that can trigger asthma is pretty huge, and honestly, it's different for everyone. For some, it's genetic. It just runs in the family. For others, it's all about the environment. Pollen, dust, even just a blast of cold air. You know, that sudden change in temperature can be enough to make those sensitive airways spasm. And yeah, even things like a tough workout or a stressful day at work can be a trigger. And this is so interesting because it shows that asthma isn't just one single thing. The most common kind, especially for kids, is allergic asthma, which is set off by stuff like pollen or pet dander. But then you have non-allergic asthma, which can be triggered by a cold or even stress. And then there are even more specific types, like exercise-induced asthma or occupational asthma, caused by things you're exposed to at work. So with all of these different causes and triggers, how does a doctor know for sure that what you have is asthma? Well, the process for diagnosing it is actually very methodical. The number one tool in their toolkit is a test called spirometry. Now, it sounds complicated, but it's really just a specialized breathing test. You take a huge breath in, and then you blow out as hard and as fast as you can into a machine. What it's measuring is simple: how much air your lungs can hold and how fast you can push that air out. And here's the really clever part. A person with asthma won't be able to push air out very fast in that first second because their airways are narrowed. But then the doctor will give them a puff of a reliever inhaler, a bronchodilator, and have them do the test again. If the score gets a whole lot better, well, that's the classic sign of asthma. It proves the blockage can be reversed. So once it's confirmed, doctors classify asthma based on severity, and it's pretty straightforward. It's all about how often you're having symptoms. If it's less than a couple of times a week, that's mild intermittent. If it's happening more often, daily or even all the time, you move up the scale to persistent. This is really important because it helps decide the best treatment plan for you. All right, this is where we pivot. We've talked about the problem. Now let's talk about taking charge. Managing asthma isn't just about reacting. It's about having a smart, proactive action plan. Let's look at what that involves.
When it comes to medication, it's best to think of it in two main categories. You've got your relievers. Think of these as the firefighters. You use them during an attack to quickly open up your airways and put out the fire. Then you have your controllers. These are the fireproofers. You take these every single day to tackle that underlying inflammation and prevent the fires from starting in the first place.
Now, having the right medicine is only half the story. Using your inhaler correctly is absolutely crucial. If you don't get the technique right, the medicine just ends up in your mouth instead of deep in your lungs where it needs to be. So you've got to shake it, breathe all the way out, and then coordinate that press with a slow, deep breath in. And don't forget to hold it for about 10 seconds. That lets the medicine settle and do its job. Beyond medicine, prevention is your absolute best friend. This means doing your detective work to figure out your personal triggers and then doing your best to avoid them. It also means doing smart things like getting your flu shot. But probably the most important thing on this list is taking your controller medication every day, even when you're feeling perfectly fine. That's what keeps that inflammation down 24/7. And really, that's the whole point of all of this. Managing asthma isn't about shrinking your world and hiding from things. It's about empowering yourself with the right tools and knowledge so you can take control and live your life exactly how you want to, without limitations. So I'll leave you with this to think about. After everything we've talked about, what's one small thing you can do today to help you breathe easier tomorrow? Maybe it's finally making that doctor's appointment or just practicing your inhaler technique. Whatever it is, just know that the power to breathe easier really is in your hands.